All right. Good morning or good afternoon. Thank you again for joining the Systems for Action Research and Progress webinar series. If you're not familiar with Systems for Action, we are a Robert Wood Johnson National Program Office. We are located at the University of Colorado, the Colorado School of Public Health. And this is an ongoing bi-weekly research and progress webinar series where we invite all of our Systems for Action grantees to come and provide some real-time rapid updates of their research that is in progress. So today you're going to be hearing, as you can see on the screen here, you're going to be hearing from a team on optimizing health services for youth experiencing homelessness, strategies for engaging youth and multi-sector community partners. You'll be hearing from the team at the University of Minnesota and their Youth Health and Housing Lab, who are also collaborating with the Hennepin County Youth Homelessness Demonstration Program, the Minnesota Department of Health, the Hennepin Healthcare System, and Minnesota Community Care, and other local youth serving agencies. You'll be getting to hear more about this collaboration and their teamwork throughout this presentation. So before we get started, I do want to go over a couple of housekeeping things. This is going to be recorded, so we'll share the recording and the slides after today's presentation. And if there are any questions that come up at any point during today's webinar, please make sure you locate the Q&A box at the bottom of your Zoom screen, enter your question in, and we will save some time at the end of today's presentation to address those questions. So with that, I'm going to hand it over to Dr. Jana Gurwitz-O'Brien and her team so that they can present on their really exciting work, and they have lots of wonderful news to share with you guys. So Jana.
Thank you for that kind introduction. Oh, here we are. Sorry, we advanced a little bit. Yes, so we're going to be talking today. My name is Jana Gurwitz-O'Brien. I use she, her pronouns. I'm an adolescent medicine physician and an assistant professor at the University of Minnesota. We're going to chat a little bit today about optimizing health services for young people experiencing homelessness. And really what I'm hoping to share with you are strategies for engaging youth and multi-sector community partners when we think and work together across sectors to improve healthcare and services for them. Here in our team, and you'll meet a few of us today, myself, and then you'll also meet Emma and Zainab and Annie, who will each introduce themselves when they kind of start speaking a bit too, who are project managers and research assistants for this project. As a lab, our goal, which is the Youth Health and Housing Lab, our goal is to lead community engaged cross-sector work at the intersection of housing, healthcare, and public health to optimize health and bolster resilience among youth experiencing homelessness. And that's where our project takes place. I'll ask Janae for you to introduce yourself first as well, and to share a little bit about your experience with the Youth Advisory Board for this project.
Well, hello, it's nice to meet everybody. I'm Janae Peterson. I work with the Hennepin County Youth Advisory Board. We do a lot of different things. We come up with a transportation plan, child care plan. We have worked on the Hennepin County Community Care Plan as well. All of these things really center around youth power and youth voice. Pretty much so for the transportation plan, we want safe, trauma-informed drivers and staff. When it comes to transportation, a lot of times youth in homeless systems are expected to use public transportation, which can be highly dangerous. It can be unsafe. It can trigger them into, past maladaptive behaviors. We work on the child care plan, which is also, we want childcare to be accessible throughout all hours of the day. A lot of emergencies happen. You can be held back for work. You might have to do overtime. There's a lot of unsaid, unspecified things that can happen in a mother's schedule, especially while she is homeless. So we wanted to make something more accessible that way. For the Hennepin County Community Care Plan, it's really just about making things easier and making things, more equal for youth in our community. We want their voice to be put on the same pedestal as an adult's, because not only do they go through the same things as adults do, but they do it without the same support that an adult may have. So really the Youth Advisory Board is just about getting youth power and youth voices out there and really trying to share it with the community. Thank you for listening.
Thank you, Janae. We're so glad you're here, and we're really excited to be having young people's voices at the table. That's kind of a big theme of this presentation, and it's a big core tenet of our work. So Janae, we're really excited that you're here sharing a little bit about your experience as a youth, and then also as part of that Youth Press Advisory Board for this project. Thank you so much for being here. All right. So we work as part of a multi-sector team, and you'll see here that we have a number of partners. We have several youth serving agencies. I saw the Bridge for Youth here. I think there's some of our partnering agencies, 108 Degrees, the YMCA, Youth Link, Oasis. We work directly with young people, with Hennepin County, with governmental public health, and with several healthcare organizations. And we really try and work across sectors to do the work that we do. We are rooted in what's called the 9 evidence-based guiding principles to help overcome youth homelessness. These 6 of the principles that we center as part of our lab include being strengths-based, youth-centered, anti-oppressive, community engaged, trauma-informed, and then we also use harm reduction approaches as well. So you'll see us kind of talk about this, and I hope that we live and breathe these tenets within every bit of the work that we do, and all of our engagement with community and youth partners. Today, for our conversation today, we've introduced ourselves a little bit. We're going to aim for 3 learning objectives. The first is going to be to list several strategies for youth engagement and for multi-sector partner engagement, from project planning to analysis to dissemination, leveraging our cross-sector model, and also for an optimizing health services project. So we'll use our project as one example, and we'll talk through some strategies for how to do this. We'll discuss opportunities and challenges for working with youth and community engagement, what challenges have we run into and how do we overcome them together with community. And then finally, we'll talk about future plans for community and youth-driven implementation. So how are we going to break this up today? We'll start with a little background and project overview. That'll actually be fairly quick. We'll spend the bulk of our time talking about strategies for youth and community sector engagement, and then we'll close up together talking about steps for moving forward and our dreams and hopes for this project and how it will go. Just a little background on youth homelessness in general. So we're talking about 4.2 million young people who experience homelessness annually in the United States. Oftentimes when people think about people experiencing homelessness or kind of conceptualize what's depicted in the media, they often depict encampments or more classic kind of sleeping on the street. When it comes to the experience of youth homelessness, it's a much more diverse and varied experience. Many young people have run away or been thrown out of their homes. And then staying in shelter is a common practice. And then also couch surfing and doubling up is a really common way that young people survive on when they don't have a stable place to lay their head at night. And one of the things we're really trying to do as a lab is to kind of shift things from what you see in the background here, from this view of encampments or the classic media depictions of homelessness, to really thinking about young people and recognizing young people for the strengths that they are and bring to the table, and recognizing that not only do they have expertise and experience to share, but they really have the wisdom and knowledge to build systems that work well for them. In fact, they are not only the experts in their own experiences, they're the experts in these systems level topics that we're working to address. We work in partnership with many amazing youth, including Janae, who really help drive the work forward. When we think about youth homelessness and what the drivers are, it starts a bit with this low wages, rising costs of living, and intergenerational poverty. These are some of the same drivers of homelessness across the age range. For young people, it's compounded by limited educational and employment opportunities that are even further, and young people face many more barriers to being able to access those opportunities. Systemic racism and oppression is a driver of homelessness across the board and across the age range, again, magnified during adolescence and young adulthood, because young people interface with many, many systems that often, though they're meant to serve them, work against them and unfortunately compound the experience and the health risk associated with homelessness. Systems involvement, including the foster system and the justice system, are direct drivers into the experience of homelessness for many young people. Domestic violence and abuse, and this can be intimate partner violence, this can be exploitation and trafficking, and then this also can be within their homes that actually before, during, and after the experience of homelessness as another key driver of youth homelessness. And then finally, immigration and global crises causing mass movement of young people across the world can also drive youth homelessness as well. So when we think about young people experiencing homelessness, they hold diverse identities, and these identities intersect with each other and further compound marginalization and oppression. So 73% of young people here in Minnesota identify as young people experiencing homelessness in Minnesota identify as BIPOC, 23% identify as LGBTQ+. We think that LGBTQ+ number is likely to be an underestimate. We also know that being Black and LGBTQ compounds the risk of homelessness. So the more, again, makes sense, the more marginalization and oppression you face related to one's identity, those intersect and those compound that risk of experiencing homelessness in the first place. This is from Voices of Youth Count data. I think our Chapin Hall colleagues are here today who put this out. Also from Voices of Youth Count data, looking at, and this is true to our local numbers as well, pregnancy and parenthood are extremely common among young people experiencing homelessness. This is part of their experience. We're talking about 1/3 of young people here in our neighborhood that are pregnant or parenting. When we look at birth assigned female adolescents, 44% of 18 to 25-year-olds, 10% of young people are pregnant or parenting. Again, this is really common. This mirrors our local data as well. We also know that youth experiencing homelessness are remarkably resilient in the face of significant trauma and adversity. Nearly half of Minnesota young people had experienced some form of physical abuse or sexual abuse. And this can occur before, during, or after living on the street or being out and unstably housed. We also know that 20 to 40% of young people in our state have experienced some form of trafficking or exploitation. These are remarkably high numbers that show that that experience of homelessness compounds other risk and further perpetuates trauma and harm. And we know that health begins where we live, learn, work, and play. This is directly from the Robert Wood Johnson Foundation. It's a way of describing the social drivers of health. We know that when a young person's home or a place where they live is not safe or stable, that can affect their health as well. So when we think about, I'm often asked, well, what are the health risks, and I'm put that in quotes, associated with being homeless or associated with that experience of housing instability? And I often get asked that risk as that question also around exploitation, incarceration, and foster systems. But what we're really talking about are health risks associated with marginalization and oppression. And yes, that experience of homelessness itself causes its own particular harms related to the elements and unmet basic needs. We're talking about trauma, violence, injury, abuse, and sexual health risk, chronic untreated medical conditions, mental health risk, suicide, substance use, and barriers to care that are all related to dysfunctional systems in many cases and structural oppression that are really driving a lot of this work. So our approach is to work across systems and across sectors to get these systems to work better together to meet the needs of young people who are experiencing homelessness, who've often been left out of the conversation, even when these things directly affect their work. We know that silos likely perpetuate inequities. When systems don't work well together, we potentially cause harm. And our approach is to get these systems to work better together. This is rooted in this cross-sector alignment theory of change. This is familiar to many of you who've worked with Robert Wood Johnson Foundation before, kind of looking at how different sectors can work together to influence outcomes at every step of implementation, and how do we align all of these systems to work well for the folks we're trying to work with and serve. Okay. From here, we'll go on and talk a little bit about this direct project and what we're doing with our Robert Wood Johnson Foundation Systems for Action funding. So this project, why did this project, or how did it come to be? And I want to just credit Janae because she was directly involved in this work from the very beginning. This project was stemmed from the Hennepin County Coordinated Community Plan, which was a plan that was developed to prevent and end youth homelessness and make it brief, rare, and non-recurring. The plan itself involved over 40 multi-sector partners, a quarter of whom were youth with direct lived experience of homelessness, thinking about how are we going to do systems change to improve the lives and to make youth homelessness rare and brief and non-recurring. There were two direct objectives that came from that plan that addressed health. One was to make sure all agencies serving youth have health services available, including mental health services. And a second was to secure funding for culturally responsive health services for youth and young adults. And when Hennepin County kind of saw these objectives coming together, they reached out to our lab and we decided to partner together to apply for this funding to think about, okay, how can we really do this work and make these health systems work across sectors better together for young people? So we have three main aims to this project. The first was a planning and implementation aim around engaging an existing multi-sector consortium that has been meeting already for 1.5 years, as well as young people experiencing homelessness, to develop and implement an integrated system of public health programming and health services for youth experiencing homelessness in and around Hennepin County. The second aim of our project is to describe the complex barriers to data systems alignment. So this is a more granular look at the data systems themselves and how they can work better together to identify potential opportunities for systems alignment and create a more equitable data ecosystem driven by the needs and wants and wishes of young people. And then finally, as we start to implement and integrate some of these, our integrated plan, to assess the feasibility and sustainment of the work and address sustainment. And this will be a 12-month funding cycle, as we've talked about. And really what we're doing is an iterative process where we're engaging cross-sector and youth input, planning, implementing, evaluating, bringing this back to focus groups, and again, kind of coming back over and over again and using the iterative process, engaging community and youth voice. I'm going to ask Janae to speak a little bit here, if you're willing to, Janae, about why youth engagement is so important in every step of this process. I know you've been in multiple projects, but if you could speak a little bit to your work with health, I'd love to hear it about, or we would too.
Well, it's a lot of things. It has honesty. Youth are living the experience, obviously. It's just like with a patient within a hospital. You want to know how the patient is doing with the care. You want to know if the patient feels that the care is appropriate. It's the same thing when it comes to youth homelessness or any youth serving agencies. You want to know how that youth serving agency is actually serving those youth. If it helps them long term or if it creates more barriers for them in the future. On top of that, there are things that only youth know. Per se, let's say there is an adult who, grew up in a stable household, never had to deal with anything like homelessness, never had to deal with anything like trying to get benefits, trying to work while taking care of another minor, things like that. They would have no idea what that side of the spectrum looks like. So when it comes to, let's say, serving youth with mental health disorders who do have to go through these systems, those systems are not made for them. Those systems are made for able-bodied people or high-functioning people with mental illness. So that's one example. You have other examples such as, let's see, even just America in general, right? We are a democracy. When something affects the many get to vote about it. The many get to have their input, and the many get to communicate whether or not they feel that it would be appropriate, let's say, for laws per se to be made. Same thing for youth in these situations. I'm going to speak from my experiences real quick. I was in a shelter while I was pregnant. Again, how homelessness can look different for different youth in different situations is I was actually put in a tent in a backyard. The state did nothing about that. The state does not protect youth, and that's one thing. Youth need to be able to speak up about their individual experiences. So as youth serving agencies, you guys can see this, quantify the data and be like, oh my gosh, these are the ways that youth homelessness look different. These are the ways that our youth are telling us that we need to change. And these are what we think the solutions could be that could be, meet both of our needs as the youth serving, organization and for the youth that we serve as well.
Janae, thank you for sharing some of your own experience too, and with this group, and also kind of shedding light on why it's so important for young people to be engaged and share their wisdom. You're right, they are absolutely the experts in their own experience, and I don't think that our project to date would be the same had we not had young people at the table from the beginning. So I really appreciate that. All right, now we're going to dive into the meat of our conversation as well, where we talk about how to actually effectively engage young people and cross-sector partners, and some of the opportunities and the challenges we face and how we move forward together. I'm going to pass it over now to Zainab. Zainab, do you want to introduce yourself a little bit too?
Yes. Hello, everyone. My name is Zainab. I just graduated from the University of Minnesota, and I'm a research assistant for the RWJF project in this lab. And I'm just so happy to be here today, and I'm excited to talk with you all. And again, thank you, Janae, for talking about your experiences. As Jana reiterated multiple times, this work will not be able to be completed without the youth themselves. And that's why our first aim, it's all about ensuring that their voices are heard and raised. So for our methods, we do needs assessment. What are the youth needing? What needs do they need with the systems that are supposed to be serving them, and also ensuring that their voices are reflected in the work and deliverable that we want to create. So this graphic represents our process of how we conduct our focus groups and how we conduct our engagement. We first conduct focus groups either with youth or staff of these youth serving agencies, because we want to create a safe and affirming space to ensure that they are able to share their stories, because as Jenna said, they are the experts of their own experiences. And we engage with the scripts directly. Us as research assistants and project coordinators like Emma and Annie here, we have to ensure that we are taking the necessary steps of really reflecting with these scripts, really thinking about what youth are saying and what staff are saying. So we aim to read scripts with no bias, and we definitely pay attention to the language. And then we go on next of coding these scripts based on the main reoccurring themes. Our whole project is centered around
what are the themes that youth are wanting from these systems, whether it be mental health support, whether if they're experiencing discrimination, financial barriers, etc. And then we take what we learned from these scripts and we bring it back to our youth and partners, because that is the most important part of our aim, is to make sure that this process is reiterative and that we are continuously bringing back our work to the youth and to the staff, because again, we can't do this without them. And we want to ensure that we're not missing anything, because that's really important to ensure that all their experiences are valued and all their experiences are brought into the work that we're doing. And of course, we implement this feedback and we narrow down themes of what is really the root of everything that these youth are going through. We move on to the next slide. All right, so this graphic again represents the common themes that we were hearing in youth interviews and focus groups with staff. And we really like our graphics in our lab. We want to make sure that we're creating graphics and visuals that really demonstrate what we're hearing, so we can bring these graphics and we can take it back to our youth focus groups and to our cross-sector meetings, where we have people from multiple organizations coming together, so we can all brainstorm together and make sure that it's a multi-sector approach, because that is really important in the work that we're doing. For example, we have transportation needs, we have more personalized care. And in the next slide, this graphic is one of my favorites. The bigger that the word is, it represents the amount of times that it was said. For example, safe space, staff being educated on LGBTQ+ issues, and free affordable care. These bigger words represent the amount of times that these themes were brought up in our focus groups and in the conversations that we were continuously having with youth serving agencies and with youth themselves. And then finally, we have this graphic here as well of what we have gathered from our first initial focus groups. These tiers represent the tiers of needs. I like to call the tiers of needs. First tier we have is the basic necessities. If basic necessities are not met for youth, then they will not go up to even think about transportation and financial barriers. And then if they are going through transportation and financial barriers, they won't be able to access mental health services. If they don't have access to mental health services, which affects our entire well-being, they won't be able to target their sexual health. And of course, then they won't be able to target the representation that they need within healthcare. All of these tiers affect the care that youth access and that youth get from our different systems that are coming together. But yeah, I hope that these sayings were able to kind of make you all aware and think of just how much every single thing and every single system affects the care that youth receive, and that it's important to touch on every single sector within the systems. And then I'll pass it on to Annie.
Awesome. Hello, everyone. My name is Annie Lemieux. I just finished up my first year in the Masters of Public Health program here at the University of Minnesota, and I'm one of the co-project managers on this project. And I'm going to talk a little bit about our community systems mapping. So as a part of AIM 1, we began this process of conducting some preliminary data collection. We surveyed 8 healthcare institutions and 8 youth serving agencies, asking questions about things like their intake process, health services offered on site, and what each institution believed to be current barriers of access. And then we took this data and presented these rough summary graphics, kind of describing what we heard. So this, for example, represents different healthcare institutions through these colored arrows. The YEH represents a youth experiencing homelessness, and those different services on the outside, the arrows connect based on where they could go to access those different services. And then if we move to the next slide, we kind of tried to do this in a couple of different ways. So on the right, you'll see that we presented the same graphic and this same collection of data just through these graphs, and we presented them at our cross-sector meeting using a system called Jamboard. So all of those sticky notes kind of around that graphic were able to be taken live from our cross-sector team, and they were able to provide us feedback so that we knew how we could improve these system mapping graphics as we move through the course of our project. And there are challenges to doing this large-scale systems mapping. We have tons of data to map up. And it's hard to make these condensed graphics, but that's also an opportunity. We have a ton of data to work with, and we have a ton of support from our cross-sector team and youth who are willing to give us that support and feedback. So I will pass it off to Emma to talk a little bit about our consensus building process in detail.
Hello, everyone. My name is Emma McGrew, and I am also a Master's of Public Health student at the University of Minnesota and a co-project manager on our Robert Wood Johnson Foundation project. So like Annie and Zainab stated, the goal of this has always been to be a very iterative process. So from the focus groups and interviews and surveys that they both discussed, we then took that and kind of brought forward the ideas that we thought were really present and strong and important, and then brought those back to our youth and cross-sector team. So as you can see in this image, these are all quotes specifically from youth that we discussed, that we talked to in focus groups and interviews, under different categories like case management, the importance of trans healthcare, mental health, both traditional and non-traditional services. And we brought all of these ideas back to our youth and cross-sector team, and all of these stars represent, we asked them to vote on which of these they felt were most important and most urgent in the population that we are trying to serve. Obviously, these are all very important ideas and things that are essential for it to be targeted to ensure optimal health services, but making sure that in our implementation plan, we are focusing on the categories that youth and our cross-sector team told back to us that were really important. I believe in the next slide is another example of this, which we again divided these into different categories and had our youth and cross-sector team tell back to us again which ones were really important to them. This is a project currently going on, so this is not shown in our slides, but then what we took from this is, of the categories that they told us were extremely important, we went back and condensed that even more, creating a plan that focused on those categories. And now we're doing this process again, going back to our youth and back to our cross-sector teams and making sure that plan reflects what they told us, and that their ideas and values and all the time that they've spent with us is really represented in that plan. And so working both with our cross-sector team and with youth, there are always going to be some opportunities and challenges. Again, like has been discussed, our youth and our cross-sector team add great value to our project. They bring us new knowledge and immense wisdom from their experiences that we that not all of us have within our lab. Some challenges that we made sure to address throughout this work and are continuing to work on as we keep going with this project is making sure that during our meetings we are engaging all of the youth and cross-sector members that are there, making sure that everyone's ideas and values are heard. Some different strategies that we've done to ensure that is starting all of our meetings and focus groups with ground rules to ensure everyone's voice is respected and valued. Definitely utilizing the chat function and different round robin strategies to make sure everyone's voice is heard, utilizing those kind of voting images that were shown in the last image to make sure, even though everyone may not feel comfortable speaking, that their opinions and voices are heard when we with the information that we take out of those meetings. We also have worked really hard to engage our youth and cross-sector team outside of in-person meetings with one-on-one conversations, outreach, and surveys, developing interpersonal connections, especially with our youth. Janae is a great example of that, having youth to call on that can help provide us feedback in both meetings like today and when we are looking for extra information and feedback on our current work. And again, a great part of our project is we're providing incentives and compensation to all of our youth and our cross-sector team, as their time and opinions are extremely valuable. And I will pass it on to Annie to talk about another way we've included youth.
Yeah, so one of our other kind of informal youth engagement methods, especially now that it's nice out in Minnesota and people are actually out and about in the outdoors again, is community tabling. So this is an image that we took from Youth Pride, which we tabled at this past weekend, where we asked youth who stopped at our table, what would ideal healthcare look like for you? And then we invited them to either add new ideas to the board using those sticky notes, or if they liked ideas that were already on the board, they could place a sticker on it and kind of upvote that idea. So that's just one other method we like to call out and to reach youth that might not attend focus groups or might not connect with us in other ways. And that brings us to aim 2, data systems alignment. So this is where we're aiming to describe those complex barriers to data systems alignment in our current systems and kind of identify those opportunities for solutions. And in order to do this, we're looking at our youth and staff focus groups and interviews, as well as cross-sector team engagement to identify solutions. And then through this consensus building process, create kind of those recommendations for data systems alignment. And one example of how we began thinking about this really complex aim is through an initial poll looking at what data systems our cross-sector team works with. And we did this by having them add to our collaborative Jamboard and think about ways that we can safely connect those systems. So this is an example of what we heard at our starting point, and you can see really the lack of connection and kind of those separated silos there. And this, of course, with everything comes with challenges and opportunities. We have to be conscious of how we can center youth voices amidst a lot of data and a lot of different types of data. And we really have to keep in mind privacy concerns and any unintended consequences that solution and action items that we may present may have, which is really why this consensus building process and youth and staff focus groups and interviews are integral and at the center of what we do. And the opportunity is to engage youth voices in creating a more equitable data ecosystem and proposing these solutions that will ultimately, hopefully, break down inequitable information silos. And through engaging these youth, we'll be able to incorporate perspectives that are really often left out of data systems alignment. So that's our hope with this aim, and I'll pass it off to Jana to talk about our next steps.
Thank you all for that summary of kind of different strategies. And honestly, hearing you all talk about it just gets me really excited to think about the different ways that multi-sector partners have been involved. I think before we move into steps forward, I think there's a lot to celebrate in this iterative process and kind of a little bit of a different strategy that maybe the like a priori we set a very specific rigid agenda and we go in that way. I think in order to be able to do this work, we've needed to be flexible and really engage in a whole lot of different ways to be able to engage youth and multi-sector voice. So thank you all for running through some of those. We're going to leave a lot of space for conversation about that at the end. So I'll ask everybody here to kind of think a little bit about how you within your own projects and labs have kind of engaged youth or community voice and what strategies have worked well for you, what opportunities have come up, and what challenges have come up as well. So I'll ask you to think about that as we think about our next steps moving forward. So within aim 1, so we've now wrapped up our needs assessment and systems mapping, and we're moving to this place of finalizing our plan for implementation. This is very much a work in progress. Like we've talked about, we've done a round of focus groups already and a round of interviews already. And now we're going back to youth with this plan and saying, hey, does this capture what we actually have said and what you've heard? Really bringing them not only their direct quotes, but also what we think is a distilled version of potential plan for implementation that feels feasible for our cross-sector partners and for the young people that have devised the project. So this includes our cross-sector team that we're bringing it back to, and then this also includes directly engaging with young people on that. Within aim 2, there's this data systems integration aim. This is the one that I think many of us in this project were most intimidated by. It's a massive ask, and there's a lot of conflicting feedback, thoughts, and ideas about what kinds of data should be shared, and also how we need to protect the rights and privacy of young people who've already been historically marginalized and mistreated often at the hands of systems. What pieces of data do young people actually want shared, and what feels hard or invasive or might be re-traumatizing? So we've been having these conversations with young people in this second round of focus groups here and really asking some more focused and direct questions about how they want data systems to work together to prevent re-traumatization, but to actually have these systems work better together to meet their needs at the data systems kind of ecosystem level. So again, we're engaging youth and cross-sector teams on that work, and it's going to be an iterative process. And then for this one, we're also engaging from each of our our cross-sector partners, and specifically our youth serving agencies. We're asking for those folks who are on the technology side to also weigh in and be like, what are the challenges that they faced and where do they see potential opportunities for connection and growth while also protecting privacy. And then this final part, aim 3, and this is where we're headed from an evaluation perspective. It's really about feasibility. So we're going to be implementing the youth and community driven interventions that we've identified, and we want to evaluate how they work. So some of the things that have come up so far, one has been taking that systems mapping that we started to do at the very beginning and turning it into a user-friendly, youth-friendly systems map, like where a young person could go in and say, hey, I'm a youth who wants this kind of care, mental health care in a culturally responsive way, to be able to click, point to mental health, and then find the place that's local to them. So how are we going to evaluate that? That's a big part of what we're doing. So we, of course, will continue to use our iterative focus groups and interviews, but we've also talked about kind of building in some evaluation into some of that technology. Likewise, one of the big implementation strategies that's starting to come to fruition is some training for youth serving agency staff and also for healthcare providers that work directly with young people experiencing homelessness. Thinking about how does trauma-informed care work and look for a young person who's been marginalized and oppressed at the hands of systems? Like, how do we create safe spaces for them? So if that training is piece of it, how are we going to, or is a big part of this, or is a next step for implementation, and that's where we land, how do we evaluate that effectively beyond focus groups and interviews? So in those cases, we'll likely use a mix of surveys and also some built-in kind of feedback during the sessions and training sessions too. And then our hope is to adapt based on the feedback that we get and based on that evaluation, to adapt the interventions in real time. So if we're hearing from young people and over again that this training, it needs to be a little bit different, or that they want the website to be a little bit different or the mapping to be a little bit different, how do we then adapt that based on their feedback in real time so that we can evaluate those changes and really make the most of this 1-year timeline? And then finally, a big goal of this project is dissemination and scale. So big deliverables for this piece: we want to be disseminating it, we want to be planning for scaling, and then most importantly, we really want to be assessing the feasibility and identifying successful strategies that can be scaled up. Okay, this final piece is about dissemination. So oftentimes in the research and in the academic world, we think a lot about academic dissemination, which is important. We want to share the work, and we want to absolutely make sure that folks around, if we learn things and as we learn things from young people, from agencies, and from our community and from our systems about how we can work better together, we want to disseminate through academic circles. We also, though, one of the principles of our work is to bring back what we've heard, what we've learned, back to the participants who are drivers of the work. So we plan to disseminate these findings back to not only our healthcare systems and academic settings, but also to our county and governmental public health partners, and directly back to the youth participants who were kind enough and willing enough to share their wisdom and be a part of this work. So we'll be disseminating back to community and then thinking about how to scale alongside community as well. I'm going to lean on Janae one last time if she's willing. So Janae, what are you hoping to see for the next steps and for the future of this work? Like, what are your dreams for this kind of work, or how do you see our systems working better together?
Really just my hope is youth and adults being able to see that they're on equal level, that when we are talking about changes within the system, it is not one going after the other, but it's how can we correspond together in the space, and how can we use both of our ideas to make the work better, not only for staff, but also to make the experience better for youth. I really want there to be just that teamwork aspect, and us realizing that our youth are our future. What we put into them matters. We are investing in our future when we invest in our youth. So I also want that to be there. I want there to just be that sense of I belong, you know, I get to belong within my community. I get to belong within my space. So yeah, I just really hope for that sense of teamwork in the future. So yeah, and that youth won't have to deal with homelessness in the future. So yeah.
Thank you. Thank you. All right, does anyone else at our team have anything that they want to add about your future goals and hopes for this project? If not, I will move along and we can open it up for a kind of discussion and questions. So we have some time for that, which is great. All right. I want to thank all of our cross-sector partners and also the young people who've been involved in this. I've included a list of everybody who's been on our team in the Youth Health and Housing Lab, and many of our community partners and our agency partners too from across sectors. But at this point, we really wanted to hold some space for Q&A and discussion around how to engage youth and community voice.
Thank you so much for your presentation. I forgot to mention in my introduction that this team received funding in our 2022 funding opportunity, and they're a developmental award. So we're going to have them for 12 months, which they mentioned. And of course, their work is focused on collaborating across the 3 sectors, which is kind of pivotal to the Systems for Action research grant portfolio. And they had a specific focus on structural racism. So I did not mention that in the very beginning, and I appreciate you guys going over all of your research aims and what we have to look forward to in the next year, and for inviting your youth to participate in the presentation. Thank you so much for Janae for joining and providing your perspective, and for being so open about your experiences. I really appreciate that, and it adds a lot of depth to the project. So with that, I think we can move into our Q&A section. I saw one question just came in. If anyone else has any questions, please feel free to jot them into the Q&A box at the bottom of your Zoom screen, and we can make sure that we ask the research team. I think Jana also mentioned if you have experience working with youth or incorporating youth voice in some of your work, if you could maybe share a little bit about that. You can do that in either the Q&A box or the chat, or if you're interested in incorporating youth voice, if you have questions about that. I think this is a good space for that kind of conversation. So I'm going to move on to our first question. Ren is a medical student working on qualitative study around experiences of people experiencing homelessness within healthcare systems. They are wondering if you could share more details about how you are approaching the dissemination back to participants in the community, trying to figure out the best format for this in my work, and how to balance capturing the important ideas without being overly sciencey and academic.
Yeah, I think, first of all, I'm really excited that you're thinking about community engaged dissemination. Personally, I think that whenever we're doing academic work, we should be translating it into a way that everybody would understand, not just the way that academic voices would understand. So I think oftentimes many journals now, or several journals now, especially those with a focus on community engaged research, are asking and really requiring that, this is a small handful of journals yet, but are requiring that when folks develop an academic manuscript or like a publication, that they're also coupling it with a community brief that's written in the language of their communities, and that really centers the voices of the communities and participants who are there. So I'm hopeful, and again, we haven't gotten to the dissemination part beyond sharing back these initial iterations of analysis at this point in implementation planning, but I'm really hopeful that we will have community briefs and like a summary essentially written in a youth-friendly manner alongside the young people who are advisors on this project to share what we've learned and what we're doing. Looking back at other projects in the Youth Health and Housing Lab, we also led a large CDC-funded project focused on COVID-19 vaccine confidence among youth experiencing homelessness. To do that work, it was a similar iterative cross-sector process. That's actually how our cross-sector team formed about 1.5 years ago, almost 2 years ago now, I think. And when we did that, what we did was, in like a very colorful and directly using the language from young people, shared back what we heard. And we actually went to multiple community events. We shared back what we heard there. We had these like large printed infographics and summaries that basically said what we heard. And we actually asked for feedback back, even at that point, to say, are there other things that we could be doing differently? Are there things that aren't really clear or understandable to you? And does this really resonate with what you hope for this project? And that took some humility and ability to kind of adapt even in that last moment and in those final moments of dissemination too. So our approach is dissemination throughout the entire project and sharing back feedback and findings and engaging youth throughout the whole project. But at the end, I really think having something as simple as a community brief that is truly written in a way that anyone could understand, I think is really key. And I think bringing that to the individuals who participated, the community partners that you have, and then also to community events and places where you can share back and be like, this is what we heard. What do you think about this? And get feedback honestly and openly. So, and I hope that answers some of your questions, but I'm really pushing myself as a researcher to do this work. I'd love to hear from the other folks on our team about community engaged dissemination. If you have ideas about why it's important or how you feel like you've seen research teams or policy workers or advocates really disseminate what they're doing back to community well. I'm happy to open that up to our rest of our team members too.
Yeah, I can speak on that a little bit, at least like going off what we've done so far and how we've presented back like focus group data and interview data. I think the more visual, the better. I think that being able to really nicely articulate in a paragraph is nice, and that's great. And you should be able to do that with your research. But I think it's really powerful if you can create that same idea and make it a visual that's really easy to access and really easy to look at, and portrays that data just in another way that people might resonate with a little bit more. So those are my general thoughts on that as of right now.
Yeah, and a lot of our infographics have direct quotes from young people or agency staff, and I think that's been really powerful for youth to see and recognize their own voices in the work that they're doing. So I think that has really helped too. Are there other thoughts on how to share back and make sure that data is shared back with the communities who actually shared and created the data?
I think the most important thing is to be transparent and honest. I think that if we open ourselves for critique and feedback, that really creates an honest relationship between us and the people that we serve, and just allowing them to speak of their own experiences and affirming them and affirming of their experiences and letting them know that your voice is valued. I hear you and I see you and I respect you for taking the time to share your experiences. It's all about the language usage, and also like if you're talking with them one-on-one, body language, and just ensuring that you give up all the facts to them. You don't hide anything, just making sure that if you create a relationship that's built on trust and transparency, then that will create the work to be to help really reflect back on what they truly do deserve and need from the systems. Because at the end of the day, we're doing this work for them and with them, emphasis on the with.
Adding on to that, I also think an important part of our project is, well, yes, there will be a larger push for dissemination at the end. We've been doing different dissemination throughout the project, and with each big step we've taken, we've shared back our work with our community partners as well as our youth. And so it's not just, they don't hear from us for a year or however long the project is, and then we give them one big paper of what we've been working on, but throughout all of the steps, we've been sharing with them our progress and our challenges and what we plan to do moving forward.
I think I see one more question, but Janae, I don't want to call on you, but is there anything you want to add to this about how you feel like young people should be shared, information should be shared back with folks who share data and share their wisdom?
I actually wanted to add something with what Emma said. It is true, like the YAB works with multiple different organizations, and just as a YAB individual member, we do share a lot of the information that we do get from meetings and partnerships such as with UFM, and we do share it out within the community. So that's another way that we make sure the community is hearing about these things, hearing about the change, and is how do you say it, being made aware that these changes are happening. And also, like I say, community connections are a really big important part of that as well.
Thank you. All right. I see one more question. I think it got in the answered section because it was a response, but it's from Angela Randall, and it says, hello, I am working with youth and young adults as they are wanting to utilize their voice by way of their advisory board. Some of the challenges are related to the funding and or payment for those who are dedicating their time to this project, specifically payment for youth and young adults. Can you discuss ways that you are able to apply funding for those with lived experiences to be compensated for their work with their projects? I'm happy to speak a little bit to this, Angela, and I will say this has been a challenge. I think when I first started working with different youth advisory boards through this Youth Health and Housing Lab a couple of years ago, the initial thing we actually tried to do was to hire youth into the university, into a large academic center. And I thought that made a lot of sense. I was like, they'd be hired, it's a job, it's a professional development opportunity. And I thought, like, on the face of it, I was like, great, this is good. What ended up happening is that it made folks jump through a billion hoops of HR. I was specifically working with youth experiencing homelessness, and many of them did not have ID, which actually caused more harm because there was tons of asking for identification, social security numbers, which is really invasive and problematic in a lot of ways. And honestly, even though I love our system, there were a lot of barriers that would be pretty traumatizing to a young person going through our system. So many hoops to jump through. It was a problem in a whole lot of different ways. So again, it was well intended, did not work. So just to share that challenge when it first came up. We then started working more closely with existing youth advisory boards, because those were spaces where young people already felt safe. They had existing relationships. They were working and they felt like they already had kind of a working relationship with one another, and with a commitment, longstanding commitment to being there. So I think that's been a way that we've really shifted. And then we've actually, even across the different projects within our lab, have different ways of paying. So we've worked with existing youth advisory boards to divert funding directly to the youth advisory board, where they actually in turn pay in whatever way the youth prefer through their youth advisory board. And then for this project, we're using a university sanctioned gift card program called a CLIN card, which allows them to be paid on a debit card that can be used anywhere. And I will tell you, and Janae, you can share your opinions on this too, because I have my own opinions on it. I think it's a hard process, honestly, even like, just to be fully transparent. Sometimes there are delays, like it relies on somebody loading up the card. So it doesn't often, it's not like giving a Starbucks gift card or a Target gift card where the money's already on the card and it's there. It's a little more complicated. We found that to be a less complicated solution, but it's still not ideal. And then I will say that the youth serving agencies I work with, who are working directly with young people, and I think do it the best, often use petty cash, which is not something that's been allowed by many of our grants and funding agencies, and then also by our institutions too. So again, we've developed different workarounds. I think no matter what, the bottom line is young people and people with lived experiences deserve to be paid for their time and compensated for their time, just like everybody else on a project team. They're equal members of our team and they deserve to be paid and compensated. Hands down, like full stop, that is necessary. The question of how to do so is something that our own very own systems that mean well for safety and privacy purposes get in the way. Then actually, I'll share one more thing about the CLIN card specific instance. A simple example is that to do CLIN cards, we need to be able to list an address. That feels like a really simple thing, but listing an address or listing a phone number or listing a birthday, which can actually affect the kinds of services young people are there for, actually gets us into trouble sometimes and actually limits the ability to pay a young person. We figured out some workarounds around that, and we use shelter-based addresses, and we've kind of worked the system in that way, just to be fully transparent. But we need to be mindful of how our large institutions are able to effectively work with communities, specifically communities that have some rightful mistrust at systems that don't really work well for them. Okay, that was a long-winded answer. Does anyone else have anything else to add about that, like part of the journey or process? And I'm looking at time too. It's 11:53. Okay, Janae, do you have something you want to add about anything? I saw some shaking heads. I think you've seen my frustration with the system. We may have discussed.
I feel like that could be a research in progress webinar all on its own.
Yes, how to effectively pay community partners and
Yes.
compensate them effectively for their time.
Yes. Which Angela, that's a great question. That is something that we always flag when we're reviewing the budgets, is making sure that people with lived experience who are providing their expertise in these projects are being fairly compensated. But I think the issue is most of the grantees that we work with are at universities, and then you have to work within those systems themselves. So it's really interesting, Jana, to hear you speak about that experience. And I will say, PD did not put a question in the Q&A box, but they did say, this is not a question, but a response. They use a platform called Tremendous, which allows use to deposit to bank, Venmo, PayPal, and other options. So I'm not sure if PD is at a university and if universities allow that, but that is a great response. And I appreciate you sharing that, PD. Does anyone else have anything to add to Angela's question, or should we move on to another question that came in?
I think we can
These
move on.
nods for heading on. Unless Janae, did you have something to share?
Nope, I said I think we can move on.
Okay, great. So this question is, what's the best way to maintain relationships between youth collectives and partner organizations, in your opinion?
Well, I've spoken a lot about this, so I'm going to pause and let the group answer it. I'm happy to. What I will add for now is that at the very beginning, which is that the relational component of this is the foundation of trust. Like, it feels really wishy-washy, but if you don't have that relationship, there cannot be trust to build on and to move forward. So when I was taught about community-based research, participatory research, or youth participatory action research, we sometimes think of the relationship itself as the vessel in which it all is which is necessary in order for all of the work to occur. And then from there is where we can really have collective generative processes. But if you don't have the trust in the relationship to begin with, it's very difficult for it to happen. So I'll pause there. I've spoken already, and I said I wasn't going to, but I'd love to hear from the group about how to maintain relationships between youth collectives and partner organizations.
I have to reiterate what Janice said. The foundation of all youth work and community engagement is trust and respect. Respect goes both ways. I think one of the main issues that youth brought up when they were talking about their experiences was the fact that adults, even people like staff that would work at youth serving agencies, they would kind of diminish the experiences that youth go through just because of their age. And we have to realize that when you go through certain things in life, then you tend to grow wisdom, and you become an expert in your own experience. So just ensuring that you respect no matter the age, like you shouldn't be looking at someone based on their age, but really looking at it based on what they went through in life, and really allowing and getting rid of that bias. But yeah, the basis is trust and respect, and just making sure that you give them the space to share what they want, and continuously making sure that you are not holding any bias, checking in on them, just as you would check in on a friend or a family member.
I think equality is a big thing. You would not talk, anyways, any way that you would talk to your youth partner, you should also be talking to your adult partner the same way. Your expectations should not change when you're looking at a youth. When I'm talking to an adult partner, I'm 18 now. When I joined the YAB, I was 17, to give a little clarification, but I would not talk to my adult partner any different than I would talk to my youth partner. So I feel like that's a really big thing. You need to unlearn this ideal that the person you are talking to is in a child's position, because they're not. You may be talking to 12-year-olds and 11-year-olds who work full-time jobs, go to school, and take care of children. So to put into perspective, age in this type of industry or field, whatever you may want to call it, really does not matter because of the experiences that these youth have had to go through, these responsibilities that have been put on them at such a young age.
I'm really glad you mentioned the adultification, Janae, that happens. And I think that sometimes this talking down and this ageism really just gets in the way of fruitful conversation, and it can dismantle a lot of that trust too. I want to add in one more thing that we haven't talked about as a way of building trust, or an important component of building trust, which is accountability. When we started this, when we were starting the lab, one of the things we did, and I think we're due for a relook at it, is we developed an equity and positionality statement. So we asked everybody who joined the lab to really reflect on their own positionality, their own relative identities, and how those identities might influence their own bias, whether it comes to biases in interpreting qualitative analysis, whether it comes to biases in interacting with young people, and whether it comes to a lack of experience in certain areas, and really to be kind of humble and reflect, and then kind of rooting in the pillars of our approaches for our lab. So that equity and positionality statement is something we come back to periodically, and kind of look at and say, have we really lived and practiced what we preached? We said that these are some of our principles that we guide ourselves in. Have we done that? Are there ways we could be doing better? And then really being honest and open with our partners to say, this is what we feel like we've done well, but this is actually where we feel like we have a lot of opportunity to grow. And I think that has been a really helpful process over the last couple of years. And I think we're due to take another look at it now that I'm thinking about it, since it's in the last few months since we took another look. So I think that has helped us be accountable. And when harms are done and when mistakes are made, we apologize and we recognize the harm and we repair, as opposed to kind of sweeping it under the rug. I think a full transparency in those situations and humility can really go a long way in accountability and trust. And then one-on-one conversations can too, and just relationship development. All right.
Beautiful responses. Thank you all so much. Janae, I love your point about unlearning, because your team is all coming together to learn together, but it is so important for folks to unlearn some harmful practices of the past. So that was really powerful to me. So we have reached the end of our Research in Progress webinar. I want to thank the team for putting this presentation together and providing this update on the research that is forthcoming and what they have done so far. They will come back to present again at the end of their project to provide some updates, but we will share a link to their project page on the Systems for Action website, so you can keep up to date with all of their dissemination work that they're doing within this next year too. So with that, I think we have a couple of announcements, if you all will stick with me. And Jan, can I have you? Yep. And then next. And I see Sadina shared the link to the page here too. Okay, so if we can go back one slide. There we go. So if you want a certificate of completion for today's webinar, we will have a very brief survey at the end of today, and it should open automatically for you. And at the very end of that survey, you can indicate if you would like a certificate of completion. And if you indicate yes, we'll get that to you in a timely manner. And then next slide. I don't think the image is popping up for this, but this is an ongoing webinar series. Our next one is happening on June 21st, as Sedina has noted in the chat. It is going to be hosted by our grantees at the University of California, San Francisco on the Medicaid waiver for whole person care that is in California. And there is a link to register, and we will also include all of this information in our follow-up email. So I thank you all today, or so much for joining us today, and I hope you have a wonderful rest of your day. And thank you again to the research team for presenting on your very important and wonderful work.
Thank you, everyone. Hi, Esme. All right, see you soon.